be divided in, the webinar is going to be divided into different parts. First, Dr. Maiada Magdi is going to explain her experience with us regarding our technology, and she's going to show she's super well as a kind of good teacher, so she's going to explain super well for sure how androgenetic alopecia works and how AMT Regenera Activa can help on the management of androgenetic alopecia. And finally, you will have some time for question and answer. So any question that you might have regarding that you want to ask directly to the doctor, or you just want regarding our technology, please type your question on the question and answer box or in the chat box, and at the end we will address. Okay. So I hope you enjoy a lot, and I'll let you with Dr. Maiada Magdi. Thank you. Hi, doctor.
Hi, Anna. So I will open my camera. You just allow me to do that. Then I will share my screen.
Okay, Fran, can you make her host? Okay, super. Yes, we can see your camera, your slides. Yeah, we cannot see you.
Because I cannot open the camera. They have to allow me to do that, if you please. Yes.
Now we can see you. So thank you for being here today.
Welcome. It's my pleasure always to be with you. Thank you for the nice introduction, and thank you for this nice collaboration and the spreading knowledge regarding one of the very promising technology of Regenera Activa. So this is my conflict of interest. The session is sponsored from Regenera Activa team, and I will start a little bit from the basics for anybody who is practicing and they are not a dermatologist. So the hair anatomy, as you know, that our hair density of the hair is 200 follicle per centimeter square, and then we have 100 to 150,000 at birth, and diameter of the hair is 0.1 millimeter, and the gross, and this, I think this question is frequently asked during your consultation. I need my hair to grow. So you can tell that 1 to 1.5 centimeter per month, the hair will grow. And the lifetime of the hair is 2 to 5 years, while the hair growth is 10 to 30 cycles. And of course, we have a cycle for the hair. And I like to teach my patients that the hair has a cycle, because if there is any disease, I will explain why the hair is shedding like the telogen effluvium, because it has a cycle. And the cycle started from the anagen phase, which is the growth phase, and 85% of patients of us has the hair in the growth phase, which will which will stay for 2 to 8 years. Catagen phase is 3 to 5 weeks, when the hair is the cessation of the activity. The activity of the hair follicle starts to be less, and the hair will go to the other phase, which is telogen phase, which is 14%, means the resting phase is 3 to 5 months. Then the new hair, anagen hair, will come back or will grow back. So the important questions during any hair clinic is how many hair falling, because a lot of patients coming with hair loss and they are thinking that it is a disease, while we have to raise their awareness that 50 to 150 telogen hair will fall every day, and we are considering this is normal hair falling or normal hair shedding. So of course it's in the light hair more the darker hair, and the shorter hair more than the longer hair. So up to 150 hair per day is normal to have hair loss. We are not considering as a disease, but after that, it could be a hair loss disorder, either physiological, like the anagen phase is shortened, or other disease like telogen effluvium, which is diffuse alopecia, alopecia areata, or universalis, or androgenetic alopecia. And we are seeing after the post-COVID, there is a lot of telogen effluvium patients right now, and they are coming frequent to the clinic with severe telogen effluvium or acute telogen effluvium. So we have to know the classification. And also we have to put in our mind that there's two kinds of hair loss. Either of alopecia: scarring alopecia or non-scarring alopecia. Scarring means the hair follicle is destroyed, means it is scar tissue. It's replacing the skin. So generally, it is irreversible condition, means the condition is difficult to treat, and even we cannot offer any procedure, even the hair transplantation is difficult. While the non-scarring alopecia, the hair follicle is not destroyed, so most frequently of the cases with telogen effluvium, alopecia areata, or androgenetic alopecia has this kind of non-scarring alopecia, and it could respond to the treatment after good diagnosis, of course. And the most common type of this non-scarring alopecia is androgenetic alopecia. I will go through the telogen effluvium very fast because actually one of the most important point is to diagnose the case. So if the case is telogen effluvium and you offer the hair treatment like Regenera, it's not yet have a lot of studies or feedback for telogen effluvium patients. So one of the gold standard for good result of the procedure is good diagnosis, is correct diagnosis. So we have to differentiate between the telogen effluvium patient, alopecia areata patient, and androgenetic alopecia patient. And from the clinical, we have excessive shedding, more than 150, which is normal. So it's more than 300 hair per day falling. And there is two categories of the diffuse hair loss or telogen effluvium, which is acute or chronic. Acute means it is sudden loss and usually reversible, like after COVID, after postpartum, after surgery, after trauma, after stress, after fever, after chemotherapy, a lot of causes. While the chronic is more than 6 months, and we can differentiate it in the clinical presentation, and also one of the gold standard in the diagnosis is dermoscopy, of course. So the feature is different, clinical history and dermoscopy as well. While treating the telogen effluvium, we have to address the cause. We have to know the nutrition deficiency. We have to do lab workout. We have to do a lot of lab tests like iron, protein, vitamin D, vitamin B12, all of these, vitamin, thyroid, of course. The treatment is non-surgical hair replacement, hormonal replacement sometimes. For menopausal patients, we have to counsel the patient, we have to support, because the stress and anxiety is one of the important causes for the telogen effluvium. On the other hand, alopecia areata is an autoimmune disease, and 7 million of Americans, nearly 147 has alopecia areata, and we are seeing a lot of alopecia areata nowadays because of the stress of COVID. We are seeing a lot of alopecia areata in the clinic. It's can happen in any sex, any age, any skin color. So it could be universalis or totalis, so a lot of types of alopecia areata. And the treatment will be with multivitamin, minoxidil injection. Of course, we are doing a lot of intralesional injection, PRP, phototherapy, according to the stage. While today our talk will be about the androgenetic alopecia, which is one of the most common cases that we are seeing in everyday clinic. And think with me, if this case could be clinically androgenetic alopecia or something else. It could be, of course, androgenetic alopecia, and it could be diffuse alopecia areata. It could be alopecia areata incognito, telogen effluvium, maybe trichotillomania, maybe hair shaft dystrophy in pattern distribution. So with clinical diagnosis only, you cannot confirm your case as androgenetic alopecia. So we have to use other methods of confirmation of the diagnosis, which usually for us is our dermoscopy, even if you are using your endoscope or other supporting tools like the photo finder one with the software that you can easily recognize the case as like the tricolab that can help you if you are not a professional in the dermoscopy or trichoscopy. Of course, at the end, we can take a biopsy if we are in doubt. So diagnosis is very important. Like this female, so we saw the male case, and this is the female patient coming complaining of this widening in the midline of her hair. It could be mild, it could be severe, like severe widening, increasing the midline and the very thin hair and the spacing, or could be this case in old age, which is not androgenetic alopecia, it's called sensile alopecia. So one of the gold standard for good treatment and the good result of the procedure that you are offering to your patient is good diagnosis. So the androgenetic alopecia is most common form of hair loss in men, affecting up to 50% of women, progressive reduction in diameter, length, and pigmentation of the hair. So the diameter is less, and what we are calling in the clinical miniaturization, this difficult word to pronounce, but this is androgenetic alopecia with reduction of the diameter, thinning of the hair that limited to androgen-dependent scalp region, or could be also diffuse if the case is late. So dermoscopy is one of the gold standard for diagnosis of the androgenetic alopecia, which having hair diameter diversity is the main clinical or main dermoscopic feature. Pre-pillar sign, yellow dots, short vellus hair on the frontal scalp, and I put this one if anybody is interested in dermoscopy to see how the dermoscopic feature of androgenetic alopecia is. The first one is hair thickening, heterogeneity, thinning, vellus hair, single hair coming from pilosebaceous units, because usually we have 2 to 4 hair coming from it. So single hair, yellow dots, perifollicular discoloration, wavy hair, or honeycomb pigmentation. And I put this dermoscopic feature for the doctor who is interested in dermoscopy with all the feature of androgenetic alopecia. From the first look, you can figure out that there is hair shaft, hair diameter diversity. So there is a thick hair, there is a thin hair, there is a vellus hair here, and there is as well the perifollicular pigmentation or peripillar pigmentation. There is a yellow dot here, and there is a honeycomb pigmentation. So this is the dermoscopic feature of androgenetic alopecia. So what is the etiology? What is the cause of the androgenetic alopecia? The main cause is hyperproduction of the dihydrotestosterone, which is coming after due to the 5-alpha reductase enzyme transforming the testosterone to dihydrotestosterone. So excess dihydrotestosterone lead to shortening of the anagen phase, and more hair will be in catagen and telogen phase, and the thinning of the hair and progressive baldness. So this is the causes, and there is other causes like 6-hormone binding globin low level and inflammation. And I want to tell about the inflammation, because we will see in the pathophysiology of androgenetic alopecia there is inflammatory cytokine that induce telogen and can accelerate the progression of androgenetic alopecia, as well as oxidative stress lead to aging process of the hair follicle and graying and hair loss. So with age, there is a production of free radicals that affect the hair follicle. And why I'm telling about the inflammation, because when we will see that one of the mechanism of action of Regenera Activa, it modulates the inflammation, it has anti-inflammatory effect, it improves the cytokines, and this is one of the pathogenesis of androgenetic alopecia. That's why we are expecting to have a good result of Regenera Activa in treating the cases of androgenetic alopecia with Regenera. And this is the cycle, as I mentioned earlier, by the effect of the 5-alpha reductase enzyme, the testosterone will have a dihydrotestosterone and lead to affection of the blocking or conversion of testosterone to dihydrotestosterone. This is the main treatment goal, which is very difficult. Even minoxidil not doing it in a good way, or other anti-androgens. That's why we are offering in treating androgenetic alopecia minoxidil and the anti-androgen, so to block the activity of 5-alpha reductase enzyme, which is still not, still we have unmet need. That's why all of the science or all of the research is going through other modalities like autologous injections of the progenitor cell, like the Regenera Activa, to work on these cycles and lead to break these cycles. So this is the cause that the 5-alpha reductase will work on the testosterone, transforming it to dihydrotestosterone, and dihydrotestosterone will affect the terminal hair and transforming it to the short, thin, vellus hair. So this is the pathogenesis. Again, we can see here in the pathogenesis there is a microinflammation of the follicular bulge. So there is inflammatory cell infiltrate the follicular bulge, and there is progressive fibrosis of perifollicular area. There is abnormality in sensitivity of the receptor to the follicular receptor to androgen, circulating androgen, and there is again dysregulation of erectobile muscle lead to replacement of the muscle by the fibrous tissue. So at the end, we will have follicular miniaturization and the vellus hair replacing the terminal hair, and there will be a reduction in total hair density. I like this slide because it is putting all the causes or the pathogenic factors that we have to put it in consideration when we are treating the case of androgenetic alopecia. So this is the pathogenesis. So how can we diagnose the case? Of course, clinical, dermoscopic, and we have to put also the scales, the male pattern hair loss scales, the Norwood and Hamilton scale. This is very important to memorize. Why? Because a good feedback, a good result from Regenera Activa is depending on good selection of the patient. So you have to put the patient in which grade, so you can offer him the treatment like Regenera Activa. So the classification, the Norwood classification, is classifying the male pattern hair loss from type 1 to type 7. And we can see here type 1 to type 4, we can offer the patient treatment like Regenera Activa. While the stage 7, and the patient with type 7 means the patient is for hair transplant. So don't offer him treatment like Regenera because the procedure will not be that effective after offering it to the patient. So the grades is very important to memorize. Which grade of the patient is very important to know. The female as well has Ludwig and Sabin scales pattern, which is mild, moderate, and severe cases. And starting from thinning or widening of the midline of the hair and thinning of the hair, this stage 1 can be camouflaged by the hairstyle. But the stage 2, there is a broadening of the midline and also thinning of the hair, the space will appear. Then the stage 3 with diffuse thinning of the hair. So androgenetic alopecia, what is the treatment options that we have? Usually the 2 FDA approved drug is minoxidil and finasteride. And usually the patient has to know how to use the minoxidil. There is no result less than 4 months, so 4 to 6 months trial before noticing any improvement. In the beginning, we have a lot of hair shedding in the beginning of usage of minoxidil, and the patient must know this information before using the minoxidil, because in the beginning they are thinking that the treatment that you are offered is increasing the hair loss, not improving it. So must be identified to maintain the response. The patient must be on minoxidil forever. What about there is no other drug FDA approved? Hair transplant, of course, is one of the options, but the patient needs to have a sufficient number of the donor, greater than 40 follicle units per centimeter square. It's a surgical procedure. It needs to be done by plastic surgeon. It has a long downtime, so there is a lot of negative feedback. Or the patient must be chosen correctly, and also the donor area must be sufficient to give the recipient area. Of course, we have the red light, low level light is there, and the patient can use. So other modalities, adjuvant treatment will be, this is our target today, to give the patient another option other than these medications that is already available. Of course, minoxidil, there is a limitation, it's good, but it's adjuvant treatment, but not as a standalone treatment. We cannot depend on it. So what is Regenera Activa AMT technology is? Regenera Activa is actually created in 2014, and the technology, the Regenera technology global distributor with the Regenera Activa is a technology brand one, and it is based on tissue disaggregation through the Regenera cone, which is provide a regenerative therapy for different clinical treatment. And as you can see here, it is the component of the Regenera Activa, which is the Regenera machine, Regenera kit, and also the kits is there, and this is the machine that you are gonna use. So it's used now for treatment mainly for androgenetic alopecia. It's also I mean that there is a facial rejuvenation could be used in the trauma and the joint, but for us as a dermatologist, we are using it as a treatment of androgenetic alopecia, and this is just to be familiar with the machine and the cone that the Regenera have. So is it approved? For me as a dermatologist, when I offer the treatment, I must be sure about the safety. This is first of all. So I must have proven document that the treatment that I will offer to my patient is approved from all the societies, like the FDA, the CA, approval must be there, and it is approved by different modalities like CA approval, FDA approval, and Japanese approval as well. So this has a high safety profile and approved from all the authorities. And it is the Regenera cone is a sterile single-use device. Each one is composed of 100 hexagonal holes, which is embraced by 6 microbladed, designed for efficient disaggregations of the hard and soft tissue. It is fast. Sample preparation of both hard and soft tissue is high safety. There's no cross-contamination and compact design, and also a standard protocol available for it. And I like to follow the protocol because if you are doing a discussion with a lot of expertise in the Regenera Activa, that some other doctor has other different than the protocol, which is nice to share also with them. But for them, they have a standard protocol. It's autologous micrograft technology, means innovative, simple, and effective methods capable of obtaining autologous micrograft and taking it from the from an area and disintegrate the tissue and taking the progenitor cell and inject it in the area which is affected by the androgenetic alopecia. So there is no tissue manipulation. It's expected clinical outcome. There is very minimal side effect, and how the Regenera Activa is allowing use of the progenitor cell properties. So it is relying on the progenitor cell. And this is what is the component. So when we are we are taking a sample from the behind the ear and put it in the machine and disintegrate the tissue and taking the progenitor cell. And what the progenitor cell have, it contains 85% from the progenitor cell. It has melanocytic progenitor, less than 10%, which is very nice to know that they have a trials and they have a studies for treating the vitiligo, because they have already a melanocyte progenitor in the disintegrated or the component of the micrograft solution that we will obtain after doing the procedure. It has hair follicle derived mesenchymal stem cell. It has vascular associated tissue, vascular smooth muscle as well. So this is the mix that we will have after disintegrating the tissue inside the machine: matrix cells, progenitor cell, and growth factors. So the micrographs are enriched in a progenitor cell that is promoting the tissue regeneration and different pathologies. The micrograft function, what is the micrograft will do, will increase the matrix production and the growth factor, will increase the tissue new angiogenesis, will modulate the inflammation. We mentioned that the androgenetic alopecia has inflammation, has microinflammation. So the tissue will modulate the inflammation and activation of the tissue remodeling through biological pathway. And this is again how the science behind the Regenera, the component that we will have containing growth factor, progenitor cell, adult cell that invades the damaged area and promote the revascularization and the regeneration of the tissue. So at the end of the day, we will have a tissue regeneration. And this is the how the Regenera work, as I mentioned in the pathogenesis of the androgenetic alopecia, that there is inflammation, and the first mechanism of action is modulation of the inflammation that happened with the androgenetic alopecia. Second is increasing the matrix production and the growth factor, which enrich the hair follicle and promote the growth of the dormant follicle to have more growth of the hairs that already dormant inside. It will enhance the conversion of the hair follicle stem cell to CD200 and CD34 positive progenitor cells that are needed to maintain the proper follicular activity. It will also increase the tissue new angiogenesis and revascularization of the dermal papillae, which is efficient. When we are growing hair, we must increase the supply, we must increase the vascularization, and one of the mechanism of action of Regenera that it will increase the tissue new angiogenesis, means new blood supply for the tissue to lead to growth of the dermal papillae, which is very important for hair growth. So this is the technology, and this is the expected improvement from it. The volume reduction of the micrograft, the volume reduction is cellular variability. It's used in more than 40 countries. There is no any legal problem of using it. So Regenera Activa now improve the clinical application of the micrograft. And this is the outcome. We will increase the epidermal thickness. So I believe that's why we are using in the rejuvenation as well. It will increase the amount of the perifollicular collagen fiber and increase in the number of existing vessels in the follicle bulb using immunohistochemical technique, following the difference between both groups in the studies proven by the immunohistochemical as well. It will increase the amount of collagen fiber and fibroblasts in the dermis, and that's why with all of these evidence we can use it as a rejuvenation treatment as well. It will increase also the fibroblast activity in the adjacent area. That's why all of these science behind using the Regenera Activa. Usually we are using as one session every 9 to 1 year, and we can repeat it in 1 year or two. And also we mentioned earlier the composition of the punches. So for the Regenera Activa, the good thing you have to make your mind when you are choosing your patient. So the patient selection is the key for a good treatment outcome. So how to ensure a proper patient selection? Of course, we have to diagnose the case clinically. We have to diagnose the case with dermoscopy. If you have the passion of dermoscopy like me, you can use other things like the tricolab, which is one of the added value for you to use it if you are not. And also for me, it will be a good point to judge, to give the patient the assessment before doing the procedure for him. It will be proven after 4 months. If you are after 4 months of doing the Regenera, you can do again the tricolab, and the result will be proven by the test, which is also convincing your patient about the result if you are in doubt. So I also recommend for you to use the tricolab if you are don't like to do your dermoscopy by yourself. So, and this all the things that you have to put in consideration. You have to put the patient, which scale is the patient, and according to that you will have a good selection of your patient. As you can see here, all of these parameters you have to put it in consideration: number of hair, distance between the follicle, miniaturized the follicle, the diameter, miniaturized and non-miniaturized the hair in the same follicle, yellow pigment, inflammation, scalp general condition you have, and each one of these items must take 1 point or 0 point, and according to that you can choose your patient 6, 7, 8 point, always treat, 5 point only treatment sometimes, from 0 to 4, so never treat. So usually with few number, very big distance, miniaturized follicles, all of these, if the patient has 0 to 4, it's never to treat because the result will not be promising. So this is very important factors that you have to put it in consideration while you are selecting your patient. So this is our treatment. This is our tray, contain a very simple procedure. It's very simple tools that all of us as a dermatologist have it in our clinic. Scissor, needles, punches, which is 2.5 punches, and the machine, of course. And this is the punch. You are removing the hair and put antiseptic like betadine and use the punch with 2.5 punches. Usually at the protocol, we will use 3 to 4 punches. Recommended from the protocol of 3, or you can use 3 to 4 punches. Put, of course, lidocaine and lidocaine at the area of the punches, and there is no stitch needed. And how many punches? As I mentioned, it's usually 3 punches. You can use, for me, I'm using sometimes 3 to 4 punches, and it is from the back of the ear. Why the back of the ear? It is cosmetically accepted area. It have a vascular micrograft from the same origin of the scalp. It's highly vascularized. The region is safer than the other. It has not a set point and also some protected. So, and this is the graft that we are taking. Then we are putting it to this aggregation inside the machine. It's a robotic surgery. You can put it, and there is no chemical process, no enzymatic digestion. There is no manual interference, and after that we are injecting the materials inside by deep mesotherapy. You are using the injected 4 ml, and the depth of injection is superficial to subcutaneous. Under the technique is point by point. It's a very simple procedure that you can do it, and this is the steps: taking the extract and put it the 3 punches inside the machine, and put 1.2 saline. Then after that, leave it to have 2 pulses. Then collect it. Then again add 1.2. Then leave it again. Then collect it. Then after that we are mixing it with a saline to have at the end 5 to 6 ml to be injected. If you like Anna to put the video, if anybody is interested to see the video, we can put it now from your side if you want.
Yeah, we are putting.
You want to put it now or I will continue?
Yes, we can put it now.
Yes, please. So I will stop sharing my screen until you will put your video.
Fantastic. Okay, let me finish. I can try to. Sorry, we are having some technical problems, but 1 minute. 1 minute and we. Okay.
The AMT Regenera Activa protocol allows obtaining micrographs from autologous biological samples. Micrographs are obtained in a fast, safe, and standardized way through automation, mechanical disaggregation, and solid tissue filtering. The Regenera system consists of 2 components, the Regenera machine and the Regenera kit. Regenera kits are disposable medical devices called Regeneracons. The complete procedure occurs in a single surgical time since it lasts approximately 30 minutes, with the advantages that the patient is both a donor and a recipient of the tissue and that it is a minimally invasive procedure. AMT activates progenitor cells in scalp tissue. It utilizes the body's own tissue regeneration mechanism to stimulate growth centers in the hair follicles, strengthening miniaturized hairs. Act with maximum sterility when setting up the surgical field. This is an outpatient procedure and could be performed outside of an operating room, but the sterility of the graft and the procedure must be guaranteed at all times. Open and order all the necessary material, then prepare the syringe with anesthesia. The skin biopsy to obtain the micrograft solution will be extracted from the mastoid hair area, since they contain hair follicles that are not sensitive to androgenetic alopecia. Furthermore, this area is enriched of progenitor cells and growth factors from hair follicles that bioactivate the scalp to enhance its regeneration. With the dermal marker, delimit the work area to be extracted from the skin samples. The selected area is in the middle of the line between the mastoid apophysis until the corner of the hair implantation line. In the middle of that line, choose 1 square centimeter into the hair implantation line. Shave the delimited area and with a Scotch tape, remove the shaved hair until the area is clean to work. Disinfect the area with chlorhexidine. Inject the anesthetic. Try to anesthetize the periphery of the extraction area by blocking and without embedding the tissue to be extracted. Use 2% lidocaine without vasoconstrictor to obtain the highest number of vascular cells, which will provide growth factors necessary to promote hair regeneration. The patient may notice a slight puncture. The slight discomfort disappears after 10 to 15 seconds when the effect of lidocaine appears. Change to surgical gloves. Place the surgical blanket to maintain sterility in the work area. Extract the samples with a 2.5 millimeter diameter dermal punch. Choose this size because it does not require suture. The procedure will require 3 dermal punches in the androgenetic alopecia treatment. To extract the sample, gently turn the punch against the skin and with a little leverage to obtain the sample. With the punch, we extract, in the form of a pyramid, the 3 samples necessary for the procedure. With the help of toothless Adson forceps, deposit the extracted biopsies inside the Regenera's device. Pay special attention so that they are between the grid and the rotor. Rotate the propeller until they are covered, since, when injecting the saline solution, the samples may remain floating. Add 1.2 milliliters of injectable physiological solution with a syringe without a needle through the specific hole of the Regeneracons. Close the Regeneracon and place it on the secure lid and couple the device with the secure stick. Connect the machine to the electrical current and a green and red light will appear flashing. Press the power button for the machine to calibrate. Meanwhile, it will make a noise. Bring the chip code that comes in the Regeneracon packaging over the RFID code mark and keep it without moving until the green light appears, which indicates that the machine is activated. Place the Regenera machine guide on the main body and engage with the machine rotor. Remember that the activation lasts 1 hour. To process the sample, position the holder correctly, fit it, and press on again. For this specific protocol, the sample must be disaggregated for 2 minutes. Each pulse lasts 1 minute. Therefore, repeat this step twice. While the machine is disaggregating the samples obtained, proceed to cure the patient and apply a Band-Aid. Superficial wound will heal in 48 to 72 hours. Normally, the patient does not need any stitches. Take the Regeneracon out of the device using the same hole on the Regeneracon's device. Collect 1.2 milliliters of solution with a syringe. Repeat the procedure to remove any final debris left inside the device. Inject another 1.2 milliliters of saline solution for injection again and manually rotate the rotor several turns. Withdraw the contents again with another syringe. Exchange the contents of the 2 syringes into a single 3 milliliter Luer lock. Then, approximately 2.4 milliliter concentrated solution have been collected. Divide the volume into another 3 milliliter Luer lock syringe with a transfer. Currently, both syringes have the same concentrated solution. Add physiological solution to each syringe to reach a total volume of 2.5 milliliter per syringe normally, the volume necessary to cover the affected area. Disinfect the capillary area of the patient with chlorhexidine. Apply the micrograft solution with a 30-gauge half-inch needle, maintaining a needle inclination of approximately 45 degrees over the scalp. The solution should be injected into a superficial subcutaneous plane and not intradermally without papule, that is, at a depth of about 4 millimeters. Gently massage the capillary area of the patient to distribute the injected solution evenly. Avoid any activity that increases the hydrostatic pressure of the blood during the first 48 hours, sport, yoga, sauna, etc. The hygiene of the wound must be controlled. Sun protection is mandatory.
Okay.
Yes, perfect. Thank you for the video. So I will start to share again the screen.
Can you? Yeah.
So
Perfect.
yes.
Fantastic.
So after seeing the video, it's very nice to have the video as well, so you can memory all the steps in preparing the Regenera Activa. So what is the post-treatment? It's already mentioned in the video. We have to do hemostasis because we already not doing any sutures for the punches. It's 2.5, no need for sutures, and also for comfort of the patient will be happy that he don't have any suture after the procedure, and we are leaving it for healing with a secondary intention. Light massage, stitch is not required. Of course, it's very important to take a picture before and after, documented with the tricolab if you have, or your dermoscopy if you like your dermoscopy only. Avoid activity that increase the hydrostatic pressure for 48 hours. Sun protection, control the wound healing. All of these is the post-treatment instruction for the patient. And you have to put your follow-up plan, and which is for me after 3 months I have to ask the patient to come to do the evaluation from 3 to 4 months to do again the tricolab, to do again the examination, and to check the patient after that. And we will do the follow-up like this for our patient. So the Regenera Activa can be combined with other modalities, yes, as we know that androgenetic alopecia is difficult to treat for problem, so we can combine this for with low-level laser, such as eye grow, that's available also, devices, hair growth supplements, no problem to combine with a hair supplement. I'm doing the also ask the patient to use anti-hair loss shampoo, better than the other commercial shampoos. It's good also to do evaluation for the patient before starting the procedure, like complete blood count. We are doing for him as well iron, ferritin, vitamin D, biotin. All of the this lab test also can be done just to be sure that there is no other causes of hair loss on top of the androgenetic alopecia. It's common for patients to reduce their dosage of dihydrotestosterone blocker finasteride after their Regenera Activa treatment, because they will benefit from the treatment. So it's act almost immediately to activate the dormant follicle, because there is a common question that it will stimulate new hair follicle. No, that it's a dormant follicle. We are stimulating the dormant follicle to have more hair that's supposed to have it in normal stage from 2 to 4, but in androgenetic alopecia it's only 1. So thin hair or lonely hair or single hair can be promoted by Regenera Activa to activate the dormant follicle to have more hair, and the early visible results can be seen within 3 months. Numerous clinical studies have shown improvement in the density and the count and the scalp coverage as early as 45 days, and also within 3 months we will expect to have this result. And reduction of hair loss in the first week is the witness, and actually you are seeing it in the real life, that the patient telling you after the procedure that the hair loss is the first thing he feels, that the hair stop loss and the hair strand gets thicker. Notice there is improved thickening and density of existing hair and the growth of new hair over the next 12 months. So this is the advantage of the procedure, that it's quick, easy, no hospitalization, can be done as a single session only a year, which is very convenient for the patient. Local anesthesia in the area of the sex, close handling system, no use of any enzyme, no extra equipment needed, no nursing, rapid recovery, because it's like 30 minutes procedure, no side effects, it's autologous tissue. So we are sure that we are taking the tissue the patient himself, affordable price according to the country that you are practicing. And this is mentioned in the video already, how to do the procedure. and we use the crib bandage. Usually I'm not using the crib bandage. Actually, in the female, I'm cutting the hair before taking the bunches. After all of these things is mentioned in the video. So of course you have to select your patient with accurate diagnosis. You have to follow the suggested treatment protocol that have been clinically tested and proven by the study, and advise appropriate post-treatment care to your patient with supplement or whatever you are the patient on any medication, he can continue like the minoxidil. And how effective or how safe is the procedure and what is the science behind it's proven by a lot of study done from the Regenera Activa side. So there is a lot of study like this study, the progenitor cell enriched micrograft as a novel option for the management of androgenetic alopecia. And at the end of the study, the results suggested the possible use of micrograft as a novel therapeutic option in the management of androgenetic alopecia, and this one in 2019 study. Another study done also to show the efficacy of the procedure before and after procedure, and the patient subject assessment of the result was positive, described an improvement mainly in the thickening and hair loss, being a well-tolerated treatment. Regarding the pain is well-tolerated, there is no side effect, and it's proven by before and after treatment with this study. Again, other study done comparing the autologous micrograft was placebo in treating this patient, which who is non-smoker, 39 years old patient affected by androgenetic alopecia grade 4 according to Norwood classification. And you can see here the difference after 44 weeks. This is the area treated with Regenera, and this is the placebo treated area. There is a very big difference between the two sides proven by the study, and all of this study before and after from the study that published in the Journal of Dermatology Treatment 2018 proven also the efficacy of before and after treatment. I will share with you two of my patients, and actually I choose this background because I consider it as a piece of art to use a simple procedure like this in a difficult to treat condition like androgenetic alopecia. So I will share with you two of my clinical cases. This is the first patient I started the androgenetic alopecia since 2 years. He is complaining of androgenetic alopecia. 25 only, very young to have this androgenetic alopecia. The condition started gradually. He was prescribed multivitamin, and also he consulted me and I diagnosed him as androgenetic alopecia by clinical dermoscopic feature. All is androgenetic alopecia, and actually I offered him in the beginning before having the Regenera Activa in my clinic. I offered him a PRP procedure, and we did a 4 session of the PRP, which is okay with him, but the result was not that perfect to continue it, and he was on minoxidil. Then after offering him the Regenera, after the availability of the machine in my clinic, I offered him the Regenera Activa, and this is his condition before doing the procedures. And the time that he came to do the procedure, he was going to the army on the military service, so he shaved his hair that time, and I started his treatment when he came with the shaved hair. After all of the sessions that I used the USA brand Eclipse with concentrated PRP and minoxidil, which was not that much, result was not satisfied. And after that, when we started doing the procedure then in May 2020, and this is the after 2 months, we can notice that there is increased thickening of the hair, and also the area is little covered by the hair, and this is the site of the biopsy after 2 months. I like to show you the area of the biopsy because it's very accepted. There is no scleroid scar, it's a very tiny scar after the procedures. And actually this is his photos after the I believe it's after maybe 6 months of the procedure, and you can see that he is the one sending me his photos because he was still in the military service in his background in the photos. So it's good result, and also he is happy with the result. So the second case is also a patient of mine from long time. She is 36 female and complaining of female pattern hair loss in 10 years. And she did a lot of courses of the PRP with minimal improvement. And she had a severe severe seborrheic dermatitis. As all of us know that seborrheic dermatitis is one of also the association with androgenetic alopecia. So always she's coming every one and then, sometimes pregnant, lactating, coming after that to do some 4 session of the PRP, which is available at the time, and the result was not convincing to her, but she is fine with the procedures available, the PRP. But when she came and I offered her to do the Regenera Activa, we did the procedures, and after that, after 4 months of the procedures, she got a thickening of the hair starting to be a little bit more, so she feels more volumized, and she's so happy with the result because she did not get that much improvement after the PRP. And also she requested to do the PRP after doing the Regenera. She liked to do the PRP. So for me, I'm the doctor that like the combination treatment. So I'm believing in combination treatment in all my treatments that I'm offering to the patient. So she is willing to have PRP as well. So with the growth factor that's in the PRP, she is still doing the PRP with me after the procedure with her good improvement. And the last one, I will share the last case. It's not a case of mine, but actually it's a case from the Instagram for one of my followers that he knows that I'm doing the procedure, and he sent to me his case before. And you can see here that this is his case, and he sent to me his details, all the Instagram, and asking me what is the procedure that can be done, because he is in a different country than mine. And he sent to me all the blood tests that he did. I told him about that is androgenetic alopecia, and I recommend one of the doctors that he knows in his country that he is doing the Regenera Activa, and he did the procedure actually with the doctor, and he sent it to me, his photo. This is after doing the procedure with very good improvement. So also it's nice to share the experience even in your social media. If your patient is the patient coming to you in the clinic, to have this kind of the procedure. So with this, I came to the end of my presentation. So I will conclude my presentation with my experience with Regenera, that I find the treatment to be safe, effective. There's no downtime. For me, I'm not doing a hair transplant because it's not allowed for a dermatologist here in UAE. I found it's very easy to do, 30 minutes only from my schedule. It's easily to practice. It's also scientifically proven for all the scientific publications that done from the Regenera side, well researched, approved from all the modalities, including the FDA and CE as well. So I found that it's advanced weapon in my armor. With this, I came to my presentations. I hope it was useful for you. I will stop sharing my screen and open the floor for discussion with Anna.
Thank you, Doctor. Amazing as always. Thank you for your presentation. I think it's super clear that you have explained. I don't know if there is any question from the attendees. Well, we can mention that, as you said previously, the most important step is the diagnosis, because with a proper diagnosis you can achieve the best results. So have you find any difficulties in knowing which patients do you have to treat or not with the technology?
No, I did not find. Actually, the gold standard is the patient selection, the good diagnosis. I'm repeating it many times because if you are offering it to other indications, you will not gain a benefit. And the most important indications, and that you already launched it, is androgenetic alopecia. So I believe one of the gold standard for good feedback or good results is good patient selection. First of all, the right diagnosis, either clinical, biopsy, dermoscopy diagnosis to confirm your diagnosis, and the patient selection. If I will choose my patient in the last stage and offering him the Regenera and he did not get a benefit, so it's a bad reputation for the procedure that's not indicated in this case. So I believe the gut selection of the patient is the key for the success of the procedure.
Absolutely, absolutely agree. Okay, we have two questions. One is, do you put a local anesthesia before injecting?
Actually, I'm not putting a local anesthesia. I'm using the vibrator, and also I'm using sometimes the ice for injection. I'm using very thin needle to inject it, and the material itself is not painful. So I'm not using only the local anesthesia that I'm using while I'm taking the punches.
Fantastic. And also they ask, the injection level is intradermal or subcutaneous, and with a needle of 30 Gs or 32 Gs?
If you have 32, well and good. And as mentioned in the video and the presentation, is the superficial subcutaneous. You cannot put intradermal, and you cannot put subcutaneous very deep as well. So superficial subcutaneous, and also 45 degrees. You can inject it like mesotherapy, 0.1 each, and you can cover all the area that affected with the androgenetic alopecia.
Okay, perfect. For that type of patient with advanced alopecia and aging, how many sessions will be recommended?
For the Regenera, as a protocol, it's for every year, one session only a year. Maybe in some cases, like personal variations, if they are sometimes have a very good result and they are willing to do it after 9 months or 10 months, you can do that. But as a protocol, it's yearly procedure.
Yeah, and also if it's too advanced, it's not worthy, as you mentioned in the presentation.
Yes.
If it's too advanced, you should go to hair transplant, because they are not going to grow new hairs from
Yes.
From the cells.
Exactly. And I believe, Anna, that now you are doing with a plastic surgeon that doing hair transplant, how to implement the Regenera after the hair transplant.
Exactly. Actually, next Monday, we are going to have an Instagram live where we are talking about this, the protocol for the combination at the same very moment of hair transplant with androgenetic alopecia. We will show the video and so. Okay, and the next question is, if patient is prone to keloid scar, it is better to avoid this procedure?
The keloid scar in where exactly? In the area of, you are telling in the area of taking the punches or the scalp? You are not doing a trauma to the scalp. You are using a very thin needle and injected in the, like the mesotherapy. So there is no incidence of scar after injection. Maybe at the site of the scar of the punches, but I believe it's very minimal punch 2.5. So the risk of the keloid is minimal as well. Even the keloid, if the patient is genetically predisposed to keloid, will be also very small area, but only in the area of the punches, but not in the injection.
Sorry, regarding the question about the advanced patients, they are saying that the problem is that with these patients, we don't have enough donor area for a transplant.
I think for advanced patients, it's difficult to provide him a treatment. Like we mentioned, if he is from 1 to 4, we can offer him Regenera Activa. But if the patient is advanced, he is for hair transplant. And also, not all the hair transplant, I believe it's suitable, because according to the donor area, if the donor area is sufficient to have the hair transplant, so he can offer the hair transplant, not the Regenera Activa.
Exactly. Maybe you can inject. Actually, we are planning to do a study with a doctor in Brazil to check if with applying Regenera in the donor area, we will be able to have better grafts to do the hair transplantation later. So we are working on that, but we haven't still started with the study. But we were thinking that maybe Regenera could help on that way too. Okay, next question.
Added value, maybe added value, but it's not as a treatment line at the first treatment line. I mean,
It's like it could enhance, but it's not the main. Exactly, I agree. Can do Regenera short anagen or loose anagen phase? Can we do Regenera for short anagen or loose anagen?
No, I think that's why we are telling about the indications. The most the indications that proven by all the study is the androgenetic alopecia, and this is the one that we are discussing right now. But using it in loose anagen or penigen effluvium or other kind of hair loss disorder, I'm not aware for any studies that done with other kind of hair loss disorder. But for right now, it's proven mainly for the androgenetic alopecia. Do you have any study going on for other indication, like anagen or?
Not yet. Not
Not
yet. We are trying to, with Dr. Tosti, we were thinking to start to do something regarding frontal hair process alopecia in order to try to make it, the remaining hairs, make it thicker, not to stop the progression of the disease because it's impossible with our technology. But it is in our also in our line, but we are not started yet.
Mhm.
Okay, can do a dermapen after injection of Regenera?
Theoretically, you can do that because already you are injecting the Regenera in the beginning and the dermapen is superficial. So I believe you can do that. But for me, myself, I'm not doing dermapen after the procedure.
Okay. And is the donor site for facial rejuvenation and AGA the same or different?
For the
Actually,
facial rejuvenation, I believe that we are discussing last time while you are here in UAE how to use it in the facial rejuvenation. It's by this as I mentioned in presentation, it has increased the thickening of the epidermis. It has increased the fibroblast activity. It's modulates the inflammations. According to this, we can use it as anti-aging treatment option. So I believe also it can be used, but for me, I don't have that experience in using it as anti-aging methods, but by the mechanism of action and how it's working, it could be. And I know that some doctors here also practicing it as a rejuvenation treatment. Maybe in the same session, they can use the remaining and put it in the face, not a separate cone.
yeah, actually there is a Dr. Perego from Italy that he has developed a protocol that is first what he does is dermapen on the face because you need to make a damage in order to stimulate the regeneration, as you mentioned.
Yes.
And later he injects the solution.
But he will do the dermapen first, then inject it, and doing the dermapen again, like other stem cells that we are practicing in the aesthetic field.
Exactly. That's the main point is that. And yes, and the donor area is the same as for AGA treatment because we are taking advantages of the cells that are within the hair follicles. Those cells, the progenitor cells that are in the hair follicles, are the main responsibles of the regeneration process because they are going to secrete all these soluble factors to the media.
Exactly. That's it.
Okay, another question is, can I choose another areas like axilla or thigh?
According to the protocol, it's done from the area chosen because a lot of things it's aesthetically accepted, and also high vascular area, and the hair in the scalp area behind the ear is non-androgen-dependent hair. So I don't have experience using it. According to the protocol we are following, it's from this area, and I believe the axilla also androgen-dependent area. Why we will use? I know that there is different character in both hair, so I believe to stick to using it in this according to the protocol is better.
Yeah, it has been said that the progenitor cells that are in the head of the hair has much more potentiality. That's why we choose that area. So, but I imagine that in case that you don't have a good area, I don't know, maybe you can try, but it's not in.
I don't think it would be a good idea. Yeah, the progenitor cell is the same in the scalp, but only non-androgen-dependent hair, high vascular, aesthetic acceptance.
Yeah.
All of these lead to it's the best choice to choose the pump.
Exactly. Another question. Can do laser cup red light after Regenera injection?
Laser, which laser?
Laser cup red light.
Does not. I don't know how many.
I don't know. Well, I know that you can combine with anything because this is a homologous and autologous treatment, but I don't know if you have any experience, doctor, with the laser cup.
Laser cup, no. But as mentioned in the slide, that you can combine it with other modalities like PRP, like laser, low-level laser, also like max hair that's available in the market. You can combine it after the procedures for better result. Always the combination is better. So there is no problem to combine it after doing the Regenera, not directly, of course. After doing the procedures, you can. But if you want to be sure about the efficacy of the procedure, I like to stay like 3 months to prove in the efficacy for myself and for my patients as well. That the result that they got it from the procedure itself. So 3 months to 4 months is the best to leave the Regenera to work. Then if you want to combine, you can combine after that. But in case the patient is in hurry, he want to do other procedure together to gain better result in a short time. Maybe they have wedding, maybe having any personal occasion. No problem to combine them after doing the Regenera activity.
Exactly. Perfect. Is there a maximum number of repetitions for Regenera? If none, where do you usually get the donor for the third session?
Where from the donor for the first session?
For the second and the third, for the following sessions.
According to the protocol, it's done every year, once every year. Usually the patient, if they have a good result, they can repeat it after 1 year. I don't have any idea that there is upper limit for the procedure to go to be stopped after certain times. But I believe if the patient is repeating it 1 or 2 years, he will have a good result, and he don't need to repeat it every year. So after 1 year or two procedures, you will be satisfied by the results. So no need to have more frequent session for it.
Yeah, exactly. Okay, how about mixing Regenera solution with PRP in the same session?
I don't like the idea of mixing in the same session because there is no study done for that, and there is no proven evidence that it will have more better results. And you don't know the interaction between the growth factor in the blood or the progenitor cells. Each one of them will affect other, or there's no evidence, there's no science behind. So I like to do the procedure. Then after that, I can offer the patient after 3 months if I want to see only the result of the Regenera, or if the patient in hurry, I can do after 1 month the PRP to have a good effect from the growth factor in the VRP as a combination treatment.
Okay, if I want to use minoxidil solution after Regenera, can do it after how many days?
You can do it if the patient is on minoxidil of any treatment. I don't like to stop him from using his treatment. Like if he is already on minoxidil, maybe the day of the procedure only he will stop, then he will start in the next day directly. So no need to stop, because after stopping the minoxidil, we are expecting to have a lot of shedding of the hair. So no need to stop the minoxidil. We can stop it from the second day of the procedure and to continue his minoxidil.
Fantastic. Okay, so better to dermapen before injection or after, and what ideal depth and use a stamping technique? I don't know if he or she is referring to AGA or facial rejuvenation. In case it's facial rejuvenation, please write us, because we can send you the protocol that Dr. Perego has developed. Okay.
But for the androgenetic alopecia, myself, I'm not doing the dermapen. Even theoretically, it is accepted. I believe after doing the injection, you can do the superficial dermapen, maybe 0.5 as depth, as only mechanical stimulations. But for me, I'm not doing the dermapen after the injecting the Regenera.
Okay. Can we use Regenera for treat alopecia areata?
This is the same question that we answered earlier for other indication. Now we are doing it for androgenetic alopecia because it's proven by the study and there is a protocol and there is a good experience in the androgenetic alopecia. Maybe there will be a further studies for the alopecia areata. I'm not aware of any studies done for the alopecia areata or telangiectasia. Maybe in the future we will have something like that, but for now, androgenetic alopecia now.
Okay, here's another question talking about well, Regenera first site of donor is behind ears. As Regenera is a type of micrograph that it should be contained a stem cell as taken from the subcutaneous fat. As most substances, fat-rich stem cells are types. Buttock or abdomen and ear area behind ear not contain more subcutaneous fat than the stem cell. Let me answer that. What we are taking advantages here is not on the stem cells that came from the fat tissue. What we are using are the cells that came from the follicular unit. It means cells that came from the bulbs and from the dermal papilla mainly. So it's those cells that are the important ones. And we are using that because they are homologous, they are homologous tissue. It means they became from the same embryological origin than the cells that you are going to treat. So the growth factors, cytokines, exosomes, and all soluble factors that those cells are going to secrete are going to be much more specific for the problems in the scalp than the growth factors that can be secreted by the stem cell progenitor cells from fat or from the PRP. That's the point, that because they are talking the same languages, so at the end the biochemical pathways that they are going to stimulate or to impair are going to be much more specific than the other ones. For this, we are taking the samples from the back of the ear.
Yes.
Okay. Okay, people are asking about the protocol for facial rejuvenation. Please, I cannot have your mails right here, so please write to marketing@regeneraactiva.com or science@regeneraactiva.com, and we will send it to you. Okay. Okay. Next question: if the patient is sensitive to pain, what would you recommend in order to perform the treatment?
You know, this is always a challenge for the patient. But usually you are decreasing the pain by putting ice, using vibrator, and also using 32 gauge needle if you have, or 30. So the pain will be minimal. And all of this, the patient will not feel the pain that much, and it will be very convenient for him to do that. For me, I'm not putting anesthesia actually before doing that, and all of us know that the topical anesthesia is not like psychological relief only for the patient.
Okay, great. How about for menopausal thinning? Can we do Regenera? But it's the same question. If it's not androgenetic alopecia, you can't.
I think we have to follow the indication right now to have a good result.
Exactly. Next question: if we need to do more sessions of Regenera, we have a scar from the previous session. Which side to use?
The other side. I like if I will repeat after 1 year to take from the other side. And if I will repair again, I can be little bit above because the punches is 2.5 only. So it will be very minor scars, and the area all around will cover it and healed. So you can do that in the other area or little bit above the one that you took last time.
Yeah, exactly. The scars are almost invisible. So, and imagine when you are doing a hair transplantation, you remove much more volume of hairs and you can repeat even. So imagine how many Regeneras can you do it. Okay, I think it was the last question. So thank you, Doctora Maiada, for being here today with us, for showing us, for teach us, help us to understand it better, for showing your results, And I think one more question of yours. Okay, yeah, the last question. Regarding the number of punches, why 3? If I can use more punches, like 8 or 10, maybe better results?
According to the protocol, there is 3 punches is enough to give you. I believe also if you will have more punches, you will have more amount of progenitor cells to distribute it if it is wide distributed area. And I remember, Anna, from our last discussion webinar, that there is a doctor from India. She did a study for a number of patients that she's taking maybe 8 or 6 to 8 punches. But me, I'm actually sticking to the protocol. Maximum for me, I'm taking 4 punches for the patient.
Yeah, actually, it's also a matter of balance. No, if you put if you disaggregate too much tissue, at the end you are going to have too many cells to treat a problem. So imagine that if there is a problem of inflammation and you want to produce a reduction of that inflammation. So if you apply so many cells, those cells, all of them will start to feel that there is an inflammation and they will start to secrete all anti-inflammatory effects. Maybe the effect of the anti-inflammatory is too higher than we needed, and maybe it impairs the chemostasis of another cell types to go to do the blood vessel network. So for this, it's important not to
have more tissue trauma.
Exactly. We have done a test on Barcelona's university just to check if we put different amounts of tissue, what is going to be the result in the survival of some cells on a plate. And we have seen that if it's too much, the cells start to die. So it's a matter of balance always. What we are doing with the protocol, with the AGA AMT protocol, is just to boost the regeneration. But if the boost is too high, it's going to be an imbalance and on the other way, and it's not going to work at the end. Yeah. And okay, as the case of AGA, not one type. AGA not same in all cases. Yeah, I think that he or she is saying that there are different kind of AGA, and depending on the kind of AGA, the results might vary. Well, have you experienced anything with that, doctor?
For androgenetic alopecia, it's either the male type pattern hair loss. So there's no specific kind. I don't have an idea about it.
Okay. So, well, if you have any further questions, please don't hesitate to write us, and we can answer it, or we can forward the questions to the doctor if you wanted that she answer for you. But please don't hesitate. And just before leaving, let me explain you that during this month we are going to have next Monday this Instagram live where we are talking about the difference, the combination of AMT technology with hair transplant in the same very moment. And also we are going to be attending the ADD Congress in Boston next Thursday, from next Thursday to from 25 to 29 of March. So if you are going to be there, please don't hesitate to visit us. We can talk directly if you have any question or whatever. And so thank you all for being here. Thank you, doctor, for your great presentation, and hope to see you all soon.
Yes, it's my pleasure always being with you, and hopefully I will see you soon. Okay. Thank you for